Welcome to this Practice Supervision Preparation module, which was initially developed by Guy's and St Thomas NHS Trust in London. We're extremely grateful to our NHS colleagues as they have kindly agreed to share their work with us here at Leeds Teaching Hospitals Trust. The training is in 3 sections. Section 1 will address interpersonal skills, including listening skills, asking questions, and equality and diversity. Section 2 will look at learning, including the practice learning environment, learners, and the learning styles. And finally, Section 3 will look at managing performance, which includes setting objectives, giving feedback, and some coaching models. This e-learning was developed in response to the new NMC standards for student supervision and assessment, which were launched in May 2018. These standards replaced the previous NMC guidance, which required us to have mentors and sign-off mentors for students. With the introduction of these standards, there will be a short period of transition when you may be supporting learners on both new and old nursing and midwifery programs. Here in Leeds, the new NMC programs are due to start in September 2020 for nursing students, but are already in place for all nursing associates who started their training after July 2019. We are already moving towards using the new terminology of practice supervisor and practice assessor. This doesn't mean that we no longer require triennial reviews or sign-off mentors or 40% contact time, because old programs will continue to run until all students on these programs complete their training.
So who will be a practice supervisor? A practice supervisor is any registered healthcare professional, such as a nurse, a midwife, doctor or AHP, who supports learning in their scope of practice and provides feedback and contributes to the learner's records of achievement and assessment. So who will be a practice assessor? A practice assessor is any registered nurse or midwife or a person with equivalent experience who has completed an assessor's preparation programme, for example SLIP. They will liaise with practice supervisors, collating learner feedback, conducting assessments to confirm a learner has achieved all the practice learning outcomes, and will communicate these with the academic assessors to ratify learners' progression.
Supervisors and assessors are pivotal in practice learning, as it is through sharing our healthcare knowledge and experience that we motivate and empower the next generation of learners to reach their full potential. To assist nurses and midwives in preparing for supporting learners on programmes with the 2018 NMC standards, we ask you to undertake some preparatory work. It will include this once-only 3-hour e-learning, and then you'll need to complete a self-assessment form to identify any personal learning. The self-assessment forms will be circulated at a later date. Annually thereafter, we ask practice supervisors and assessor to complete an episode of education reflection, which will be discussed at your annual appraisal with your line manager, who will confirm you meet the practice supervisor and assessor standards. For those of you on an NMC register, this reflection will contribute to your NMC revalidation. If you are a practice assessor, you will be required to attend an annual update workshop where you can explore practice supervision and assessment. Those of you who are on a practice supervisor will be able to attend an optional support workshop where you can ask any questions related to your role. Both sessions will give you the opportunity to explore and practice your coaching skills. Dates for updates and support workshops are available on the Trust intranet.
Hello, my name is Doug, and I'm a practice learning facilitator here at Leeds Teaching Hospitals Trust. Please note that the new standards are moving practice away from a model of mentoring to more of a coaching model. As Timothy Galway states, coaching is about unlocking a person's potential to maximise their own performance, helping them learn rather than teaching them. We are encouraged by practice and learner feedback where the coaching model has been introduced, and that the education team continue to help areas to change the way they support learners by moving them to a philosophy of coaching. Should you need any additional help or information with coaching, you can ask the practice learning facilitators. Remember, the skills learnt from this module can be utilised for any type of learner, and they enhance your skills to provide a positive learning environment.
This is a picture of the education team. We are from a variety of healthcare professional backgrounds and have a wealth of practice and educational knowledge and experience. The team is made up of Head of Nursing, responsible for workforce and education. We have a lead nurse for education, and there are practice learning facilitators who are responsible for quality placements of non-medical students. Project leads for education who are responsible for Best Start, the introduction to professional practice training for new nursing and clinical support staff, and post-registration education. The different titles may be confusing, but we are all here to support you with your education and learning in practice. Please don't hesitate to contact us should you have any questions.